देखते हैं
Yeah. So just a minute, guys. So good evening, guys, to everyone. As we have discussed in the last class of FMGE June 2021 recall questions of PSM and FMT, today we'll be discussing some more topics, some more subjects, that is your pharma, psychiatry, pathology and orthopedics. Okay, so these were the topics, these were the subjects from the paraclinical stuff and orthopedics from the clinical one, which were given a lot of importance. In pathology, there were many questions, like always. So just a minute, bear with me for a while. So we'll be moving forward with the next ones, so sorry for the inconvenience. Let's move ahead, guys, today with the next questions. So last time we stopped over here, just a minute. Yeah, so this was the last question we stopped at. So let's begin now with our session for today. We'll be discussing some important questions. Please do remember this FMG exam had a lot of repeat questions, and that can also be carried forward to the December 2021 attempt too. So please remember this, that always in FMC exam there are a lot of times the same repeat questions. So this session is not only important for the ones who have been who have given the exam already, rather also for the ones who are about to give the exam in December 2021 attempt. So the first question that we had was from pathology and overlap from microbiology as well. So the question was, the following image is of which of the immunoglobulin? So as we all know, there are 5 types of immunoglobulins. Those are known as GAMDA. So please remember, the following image is of which immunoglobulin? The options were IgA, IgG, IgM and IgE. So any answers in the chat box? So please drop the answers in the chat box. Okay, so do remember this, guys. Please remember, as we all know, the antibody is a Y-shaped structure, right? So the antibodies are nothing but a Y-shaped structure, okay, with the heavy chains, with 2 heavy chains and 2 light chains, as you all know. Okay, so please remember, and one of the antibody is considered as a monomer. Over here we can find 5 of them. Okay, 1 2 3 4 and 5. So this is a pentameric structure. Okay, so this is a pentamer. And which immunoglobulin is a pentamer? As we all know, the highest or the maximum molecular weight and a pentameric structure is of which immunoglobulin? It is your IgM immunoglobulin. So please remember, IgM is the immunoglobulin with a pentameric structure, and also it has the maximum molecular weight. It also has the maximum molecular weight. Important thing to be remembered. Okay, please remember this. Then IgA has a dimeric structure. Okay, IgA is the only antibody with a dimeric structure, other all are monomeric, and IgA is the antibody which is found in secretion. So please remember, in all bodily secretions including the breast milk, the maximum amount of immunoglobulin present would be IgA. But here the question was, which of the following immunoglobulin is a pentameric structure as seen in the image, and that is your IgM antibody. Moving further guys, now which of the following combination of seizure type and its first line drug is not correctly matched? Okay, so please remember, here in the further options we have some types of seizures and the drug of choice or the preferred drugs that are used for that particular type of seizures, and the options were: A, generalized tonic-clonic seizures, valproate; B, myoclonic seizures, topiramate; C, absence seizures, ethosuximide; and D, focal seizures, levetiracetam. So as we all know guys, there are different types of seizures. Over here, first option, GTCS, in the generalized tonic-clonic seizures, sodium valproate is considered the drug of choice. Therefore this option is correct. Okay, then let's go first to the third option. In absence seizures, as we all know, there are two types of absence seizures: typical and atypical absence seizures. Okay, so if in absence seizures the child is less than 4 years of age, the drug of choice would be ethosuximide. If the child is less than 4 years of age, the drug of choice is ethosuximide. If the child is more than 4 years of age, then the drug of choice would be sodium valproate. Please remember, in case of absence seizures, if the child is more than 4 years of age, the drug of choice should be sodium valproate. And whereas in focal seizures, levetiracetam is one of the safest option that is considered nowadays. As we all know, levetiracetam is the safest anti-epileptic drug in pregnancy. So please remember, it is the safest drug. So it is also used in cases of focal seizures. So please remember, the only option which is actually not going along over here is the option B, myoclonic seizures. The preferred drug over here should be sodium valproate and not topiramate. Therefore the option B is a false option, and therefore that was the correct answer in this question. Moving further, next question was, which of the following drugs can be used for the treatment of undescended testers? Okay, so normally undescended testers is what? It is your cryptorchidism. Please remember, it is nothing but your cryptorchidism. Okay, undescended testis is your cryptorchidism, where the testes, while descending down, they get arrested at the level of your inguinal canal. So please remember, the most common site of undescended testis is your inguinal canal. The most common site for undescended testis is your inguinal canal. Please remember. So this was the case of cryptorchidism. And which of the following drugs is used in cases of undescended testis? As we all know, testes are actually in the scrotal sacs because it cannot handle the abdominal pressure, the core body temperature, and therefore there would be fertility issues. Okay, if it is an undescended testis where the testis is in the abdominal cavity or it is in your inguinal canal, there would be high body temperature. Okay, so this high body temperature would definitely impair the sperm production or spermatogenesis, of leading to infertility. Therefore in this cases, GnRH, that is your gonadotropin releasing hormone, are the drugs which are used for resolving your fertility issues. Please remember this. Moving further, and just a minute, over here the treatment of choice is fast in cases of undescended testis. So please remember, the treatment of choice is surgery, and the surgery name is orchidopexy. Please remember, the treatment of choice in cases of undescended testis would be surgery known as orchidopexy. Moving further, an elderly male developed symptoms of dementia and was diagnosed to be a case of Alzheimer's disease. Which neurotransmitter level is reduced in this condition? So as we all know, so this was a case of dementia diagnosed as Alzheimer's. So क्या होता है, usually when we start reading a question we come to a diagnosis, but in some questions the diagnosis is already given, and this is one of that type. Okay, so they have just asked which is the neurotransmitter deficiency in this case. So as we all know, in cases of Alzheimer's disease, it is your option D, that is your acetylcholine. So please remember, acetylcholine deficiency is seen in cases of Alzheimer's disease. Please remember, this is very much important. Okay, ApoE4 gene mutation is seen. Okay, which gene mutation is seen? ApoE4 gene mutation is the one which is responsible for Alzheimer's disease, and there would be acetylcholine deficiency. Please remember. And the one more important thing to be remembered is the most characteristic lesion in cases of Alzheimer's disease? The most characteristic lesion seen in cases of Alzheimer's disease are your neurofibrillary tangles. Please remember, those are your neurofibrillary tangles. Okay, and Alzheimer's disease is the most common cause of dementia. Please remember. Okay, so most common type of dementia कौन सा होता है? It is your senile dementia, which is associated with old age, and the most common cause of senile dementia is your Alzheimer's. So please remember, Alzheimer's disease is the most common cause of dementia. Moving further, next question was hormones and endogenous substances that are involved in the regulation of calcium balance in the body are. So this was overlap of this was actually a physiology question. So please remember, over here the options were option A vitamin D, parathormone, insulin; option B vitamin D, calcitonin, thyroid stimulating hormone; option C vitamin D, parathormone, calcitonin; and option D vitamin D, growth hormone, thyroid stimulating hormone. So please remember, insulin is not involved in calcium homeostasis. Okay, neither is thyroid stimulating hormone. Therefore these options would be ruled out. So the correct option over here was option C. Okay, and the answer was vitamin D, parathormone and calcitonin. As we all know, vitamin D or 1,25 dihydroxycholecalciferol, which is the active form of vitamin D, also known as calcitriol, it acts at 3 organs. Okay, so please remember it acts at 3 organs. In intestine it increases the absorption of calcium. In intestine it increases the absorption of calcium. In kidneys it increases the reabsorption of calcium and phosphate. In kidneys it increases the reabsorption of calcium and phosphate. And on bones it increases the mineralization of calcium. In bone it increases the mineralization of calcium. The net effect of vitamin D would be increasing plasma calcium levels. Okay, please remember. Next one is your parathormone. Parathormone is secreted by your parathyroid gland, and this parathormone actually increases your serum calcium levels. Okay, this parathormone would lead to increase in your serum calcium levels. And ये कैसे होता है? It leads to resorption of your bones. So please remember, parathormone causes resorption of bones, which leads to demineralization of bones and release of this calcium into the serum or the plasma, increasing its level. Okay, and the last one, that is your calcitonin. Calcitonin is actually an physiological antagonist, we can say, of parathormone. So please remember, calcitonin decreases plasma calcium levels. Okay, so please remember, calcitonin decreases plasma calcium levels and it increases mineralization of bone. It increases mineralization of bone. Okay, so please remember, here the answer was vitamin D, parathormone and calcitonin. Moving further, guys, now the next question was, a pregnant female presents for antenatal checkup. She had a history of previous child with Down syndrome. Okay, then and is currently on lithium therapy. Which congenital anomaly the fetus is at highest risk for? So please remember, she's a pregnant female. She had a history of Down syndrome prior in her previous pregnancy, and now she is on lithium therapy. And as we all know, which of the congenital anomalies is commonly associated with lithium intake? So please remember, it is your option B, that is your Epstein's anomaly. It is your Epstein's anomaly, which is the most common congenital anomaly associated with lithium therapy in pregnant females. Please remember. So as we all know, lithium is a teratogenic drug, therefore it is mostly avoided in cases of pregnancy. Lithium is the drug of choice in cases of acute mania. So please remember, in cases of acute mania, the drug of choice would be, so please remember, in cases of acute mania, the drug of choice are actually nowadays considered to be atypical antipsychotics. Okay, they are now considered to be atypical antipsychotics. But in cases of maintenance, the drug of choice would be lithium. Okay, also in bipolar disorder we use lithium. Therefore, if there is bipolar disorder or if there is mania in pregnant females, we usually tend to avoid lithium. Okay, because it can lead to this congenital anomaly known as Epstein's anomaly, जिसमें क्या होता है, there is a tricuspid valve malformation, and due to that leads to a characteristic appearance of the heart on a chest X-ray, and this appearance of the heart is known as a box-shaped heart. So please remember, Epstein's anomaly is nothing but a box-shaped heart due to a tricuspid valve malformation associated with lithium drug intake. Moving to our next question. An elderly 65-year-old male patient presented with tremors rigidity and slowness in movements. The most likely neurotransmitter deficiency which can be seen in the brain of this patient is. So क्या है, एक elderly patient है around 65 years, okay, symptoms क्या क्या है, tremors है, okay, rigidity is there and slowness in movements which is also known as bradykinesia. इसको क्या और बोल सकते हैं हम, it is also known as bradykinesia. So please remember, this is a triad of some disease: tremors, rigidity and bradykinesia. So please remember, yes, we have come to a diagnosis, and that diagnosis is Parkinsonism. So please remember, this is a characteristic case of Parkinson's disease or Parkinsonism. Now what they have asked us, the most likely neurotransmitter deficiency which can be seen in the brain of this patient, and the options are A. acetylcholine, B. dopamine, C. adrenaline and D. serotonin. So as we all know, in cases of Parkinsonism, which neurotransmitter is deficient? So please remember option B, Bombay, okay, dopamine. So please remember, dopamine is the neurotransmitter which is deficient in cases of Parkinsonism. So please remember, as we all know, dopamine is secreted by your substantia nigra. Okay, it is secreted by a part of basal ganglia that is known as substantia nigra. So in cases of Parkinsonism, as there is decreased secretion of dopamine, there would be pallor of this substantia nigra. Okay, substantia nigra is black in color, darker in color, but as there is dopamine deficiency which imparts the color to substantia nigra, there would be pallor of this substantia nigra seen in cases of Parkinsonism. One more question from pharmacology that you need to remember for Parkinsonism is your drug of choice for Parkinsonism, and the drug of choice for Parkinsonism is your pramipexole and ropinirole. We tend to make a mistake over here. Please remember guys, it is not the levodopa-carbidopa combination. Levodopa-carbidopa combination is the most effective drug therapy that is available for Parkinsonism, but it is not the drug of choice. The drug of choice are pramipexole or ropinirole, and the drug of choice in cases of drug-induced Parkinsonism. In cases of drug-induced Parkinsonism, the drug of choice is benzhexol. These questions have been previously asked, so do remember these, okay? So benzhexol is also known as trihexyphenidyl. Please remember. So these are the drugs used in cases of drug-induced Parkinsonism. Moving further to our next question now. A patient was on treatment of myasthenia gravis. Okay, so please remember guys, myasthenia gravis and multiple myelomas are the hot shot topics that are repeatedly asked in this MCI exam or any of the central board examinations. Please remember this. So a patient was on treatment of myasthenia gravis, presents with progressive muscle weakness. Which among the following drug will be used to differentiate myasthenia gravis from cholinergic crisis? Okay, as we all know, myasthenia gravis is more common in female sex. Please remember this. It also presents with progressive muscle weakness throughout the day. Okay, it presents with progressive muscle weakness throughout the day. ठीक है? So as the day progresses, the muscle weakness would be progressing. Please remember, okay? And here यहाँ पे क्या question है? So they have asked us that what is the drug which can be used to differentiate myasthenia gravis from cholinergic crisis. So if this drug is given, okay, so please remember, if this drug is given, then in cases of myasthenia gravis we can see improvement in this muscle weakness. We can see improvement. Whereas in cases of cholinergic crisis, after this drug there would be worsening of the symptoms. And this drug is a cholinergic drug which is known as edrophonium. So please remember, edrophonium is the drug which is used to differentiate myasthenia gravis from cholinergic crisis. In cases of myasthenia gravis, we have a screening test where we use edrophonium, after which there is improvement in the symptoms of myasthenia gravis patient, and this test used as a screening test in cases of myasthenia gravis is known as your tensilon test. Okay, please remember, it is your tensilon test. myasthenia gravis के बारे में और एक important बात क्या याद रखोगे? The investigation of choice for myasthenia gravis. Nowadays it is not tensilon test. We tend to make a mistake over here. So please remember, tensilon test is just a screening test, whereas the investigation of choice for myasthenia gravis would be a single fiber EMG. And what is a single fiber EMG? It is your single fiber electromyography. Okay, so please remember. Moving further, a patient was brought to the emergency of your hospital after a road traffic accident. The patient has raised ICP Okay, the patient has raised ICP without any active bleed. So no active bleed is there. Which of the following is the preferred drug for the management of this patient? So this is the case of RTA. Over here the patient is presenting with raised ICP. As we all know, please remember, in cases of raised ICP, which is the classical triad which is seen, please remember raised ICP is an important question. Okay, so raised ICP can be due to various causes. It can be due to any malignancies, it can be due to hydrocephalus, it can be due to any infections. Okay, so there are multiple causes of raised ICP. It can be due to meningitis. So raised ICP का classical triad क्या है? उसका mnemonic है HIB. Okay, so please remember. And the triad is hypertension, irregular breathing. Okay, irregular breathing. This irregular breathing in cases of raised ICP has a characteristic name known as Cheney-Stokes breathing. This is known as Cheney-Stokes breathing. And B goes for bradycardia. So please remember the classical triad of raised ICP is hypertension, irregular breathing and bradycardia. Okay, along with this there would be some ocular manifestations also in cases of raised ICP. So over here there is a case of raised ICP. So the drug of choice that we prefer in cases of raised ICP is your nothing but your mannitol. So please remember the option A was the correct answer over here, that is your mannitol. And mannitol का mechanism of action क्या है? So please remember mannitol is a osmotic diuretic. Please remember mannitol is nothing but a osmotic diuretic, which is used in cases of raised ICP to decrease the intracranial pressure. Whereas if the case would have mentioned there is any active bleed present, if there is any active intracranial hemorrhage, then please remember mannitol is absolutely contraindicated. In cases of any active bleed or any active intracranial hemorrhage, mannitol is absolutely contraindicated. Please remember, because it can lead to cerebral herniation. Please remember, it can lead to cerebral herniation. Mannitol is also relatively contraindicated in cases of pulmonary edema. It is also contraindicated in cases of pulmonary edema. Also in cases of severe renal diseases. In cases of severe renal diseases, and also in cases of severe dehydration. Also in cases of severe dehydration. Moving further guys now to your next question. A 30-year-old lady presented after she was stung by bees. Okay, so please remember 30-year-old lady presented to the casualty after she was stung by bees. She developed swelling all over the face. Okay, and complaints of respiratory difficulty also. On examination, blood pressure was 90 by 55 mm of Hg. That is, she is hypotensive somewhat. Okay, she is somewhat hypotensive, please remember. So the most preferred drug used in this condition would be, so please remember, if there is a case where the patient is actually presenting after he or she was stung by bees, or if any allergic condition or contact with any allergic substance, please remember this most likely would be a case of your anaphylaxis. Please remember, and as the lady is going into hypotension, so please remember this is a case of your anaphylactic shock. Okay, so please remember it is anaphylactic shock, and it is which type of hypersensitivity? So anaphylactic shock is type 1 hypersensitivity. Type 1 hypersensitivity होती है. Okay, also known as your immediate type of hypersensitivity. So please remember, in this what happens, there is swelling or edema all over the face or at the site, and there is also laryngeal edema which is actually leading to this respiratory difficulty. So please remember, this is a typical case of anaphylactic shock. Some people say that the transmitter was asked. Okay, so the mediator was asked which is responsible for anaphylactic shock. If it was about the mediator, the answer would have been histamine. So please remember, which is the most important mediator in cases of anaphylactic shock? It is your histamine, and histamine is released by your activated mast cells. So please remember, histamine is released by your activated mast cells. So please remember. Now they have asked over here the most preferred drug used in this condition is, and the options are noradrenaline, adrenaline, dopamine and isoprenaline. So as we all know, the drug of choice for anaphylactic shock is nothing but option B, that is your adrenaline. So please remember, adrenaline is the drug of choice in cases of anaphylactic shock. Okay, and the preferred route of administration in cases of anaphylactic shock is intramuscular. Please remember, adrenaline is given intramuscularly in cases of anaphylactic shock, and the dilution is 1:3. 1000. Please remember the dilution is 1:1000. Whereas adrenaline is also a drug of choice in cases of cardiac arrest. And उसमें कैसा दिया जाता है? It is given intravenously in cases of cardiac arrest, and the dilution is 1:10,000. Okay. So these are the probable questions related in and around to anaphylactic shock and adrenaline that you guys need to remember. Moving further, guys, now to the next question. A patient was given halothane. As we all know, halothane is a inhalational anesthetic agent. So the patient was given halothane for maintenance of general anesthesia. He developed muscle rigidity and hypothermia. These symptoms are most likely due to which ion? So they have just twisted this question all around. So please remember, as we all know, after giving an anesthetic agent, if the person develops muscle rigidity, hypothermia, this is most likely a case of malignant hypothermia. This is most likely to be a case of malignant hypothermia. And malignant hypothermia is associated with mainly which anesthetic agent? It is associated with succinylcholine, and it is also associated with halothane. So please remember this. So it is a case of malignant hypothermia where there is muscle stiffness or muscle rigidity, there is hypothermia, okay, there is tachycardia, and there is raised CPK levels also. They will also say there is raised CPK, that is creatinine phosphokinase levels are elevated. Okay, so this is a particular case of malignant hypothermia. Over here, what is the basic pathology? So please remember, this is a pharmacogenetic condition. Okay, malignant hypothermia, it is a pharmacogenetic condition. So the individual is already genetically predisposed. Okay, there is some mutation, and if we actually give some drugs which can lead to this condition, then this combination can lead to this malignant hypothermia. Okay, so please remember, this is a pharmacogenetic condition. It is associated with ryanodine 1 receptor gene mutation. So please remember, they are associated with ryanodine 1 receptor gene mutation. Please remember this. And ryanodine 1 receptor is actually responsible for what? It is actually responsible for taking up all the calcium which was released into the cytoplasm. So please remember, while muscle depolarization, the calcium has been released into the cytoplasm. After depolarization, the calcium has to be reuptaken into your sarcoplasmic reticulum, and this is done by your ryanodine receptors. Okay, so please remember, if these ryanodine receptors are mutated or these are defective, there would be increased levels of calcium in your muscle, which leads to this excessive muscle rigidity. Okay, so what is the answer over here? Which ion is responsible? So please remember, it is your option C. Calcium is the ion which is responsible for causing malignant hypothermia. Moving further to your next question, guys. A lady was diagnosed as a case of thyroid cancer. Okay, and was planned for radioiodine therapy. As we all know, radioiodine is a very effective therapy used nowadays in cases of hypothyroidism also, and in cases of thyroid cancer also. Okay, which among the following isotope of iodine is used for the treatment of this patient? And the options are: option A, iodine 131, option B, iodine 123, option C, iodine 127, and option D, iodine 125. So हमें क्या करना है? We need to treat the patient. Okay, the iodine is to be used for the treatment of this patient. मतलब there is a therapeutic role of this iodine, and as we have discussed, which is the therapeutic iodine? So please remember, the therapeutic radioisotope of iodine is iodine 131. Please remember, the therapeutic radioisotope of iodine is iodine 131, whereas diagnostic are all these three. Okay, iodine 123, 127, and 125 are all used in cases of diagnosis. Okay, they are diagnostic, they have diagnostic uses. Okay, so please remember, the most important being iodine 123. Okay, so iodine 131, इसकी half life पूछी जा सकती है. So please remember, the half life of iodine 131 is 8 days. Okay, the half life is 8 days. Mechanism of action क्या है? It emits beta rays. Okay, so please remember, it emits beta rays, and it causes destruction of the follicular cells. Okay, or all the cancerous cells. So please remember, this is the basic mechanism of action of this iodine 131. Okay, and the half life of iodine 123 is 13 hours. Half life of iodine 123 is 13 hours. Okay, moving further to your next question, guys. Now, drug of choice for the treatment of digoxin induced ventricular arrhythmias. This question is a common repeat which has been repeated multiple times in your examination. So please remember, the drug of choice for digoxin induced ventricular arrhythmias is nothing but, it is your option B, lidocaine. So please remember, it is your lidocaine. So please remember, as we all know, digoxin is a digitalis. It is a cardiac digitalis. Okay, so please remember, used in cases of shock plus oliguria. So digoxin is a drug which is used as the cardiac digitalis. So digoxin का most common side effect अगर पूछा जाए तो, so please remember, if they have asked the most common side effect of digoxin, then your answer should be nausea and vomiting. Then your answer should be nausea and vomiting. But if they have asked the most characteristic type of arrhythmia, okay, so please remember, arrhythmias are seen with digoxin, but they are not the most common side effect. Okay, ये बात याद रखनी है. And if they ask the most characteristic arrhythmia seen in cases of digoxin, okay, so please remember, then your answer should be NPAT, that is your non-paroxysmal atrial tachycardia with AV block. Okay, these are the most characteristic arrhythmias associated with digoxin, and the most common arrhythmia associated with digoxin toxicity would be ventricular bigeminy. It is your ventricular bigeminy. So please remember, there can be ventricular arrhythmias or ventricular tachycardias associated with digoxin, and the drug of choice which is used in these cases is your lidocaine, which is also used as a local anesthetic agent. Okay, it blocks your sodium channels. So please remember, it blocks your sodium channels. So lidocaine is used in cases of ventricular arrhythmias. Okay, if this question was about ventricular fibrillation, so please remember, the treatment of choice for ventricular fibrillation is your non-synchronized. It is your non-synchronized DC shock. Kitna joules? 200 joules biphasic. Please remember this. Okay. Moving further. Which of the following antimicrobial drug is contraindicated in a patient with seizure disorder? So please remember, the options were A. ampicillin, B. amoxicillin, C. moxifloxacin, and D. doxycycline. So in cases of seizure disorder or in cases of epilepsy, the antibiotic which is actually contraindicated are your fluoroquinolones. And which is the fluoroquinolone among all the below given options? So please remember, yes, it is your option C, that is your moxifloxacin. So please remember, moxifloxacin or any of the fluoroquinolones are relatively contraindicated in cases of seizure disorders. So please remember this. Okay. Then moving further, which among the following antidepressant drug act by inhibiting the reuptake of both serotonin and noradrenaline? Some people say that it was a proper clinical case which was given and then this was asked. Okay, so please remember, anyhow, the main question was which among the following antidepressant drug, okay, acts by inhibiting the reuptake of both serotonin as well as noradrenaline. So इससे क्या पता चलता है ग्रुप कौन सा है? So they are asking about the group SNRIs, that is your selective they are asking about the group selective serotonin and noradrenaline reuptake inhibitors. So please remember, they are asking about serotonin noradrenaline reuptake inhibitors. Okay, so SNRIs group के बारे में पूछ रहे हैं and they are asking the drug name from this group. So the options were A. venlafaxine, B. fluoxetine, C. nortriptyline, and D. imipranim. So please tell the answer. So please remember, the answer over here would be venlafaxine. So please remember, this was an overlap from psychiatry as well. So please remember, the option over here was A. venlafaxine. Okay, it was the answer over here. So venlafaxine or desvenlafaxine, these are the drugs which are serotonin noradrenaline reuptake inhibitors. Okay, important one to be remembered. Whereas fluoxetine is a SSRI, that is your selective serotonin reuptake inhibitor. Okay, fluoxetine is your selective serotonin reuptake inhibitor, whereas nortriptyline and imipranim, both of them are your TCA, that is your tricyclic antidepressants. Okay, important one. Moving further now, which is the longest acting phosphodiesterase inhibitor among the following? So please remember, phosphodiesterase inhibitors are given in the below options. Options are A. sildenafil, B. tadalafil, C. vardenafil, and D. phentolamine. So please remember, the answer over here was option B, tadalafil. Okay, the answer over here was tadalafil. Okay, it is the longest acting phosphodiesterase inhibitor. So please remember, phosphodiesterase 5 inhibitors होता है. Okay, these are your phosphodiesterase 5 inhibitors. Okay, please remember this. Moving further, vitamin which increases the absorption of iron in the gut is, and the answers were, this was again overlap from physiology biochemistry, and the options were option A, vitamin D, option B, vitamin B12, option C, vitamin C, and option D, vitamin A. So what would be your answer? So please remember, the vitamin which increases the absorption of iron in the gut is nothing but your vitamin C. So please remember, vitamin C is responsible for increasing the absorption of your iron. So all the non-heme iron is actually its absorption is increased by this vitamin C. Therefore, if iron supplements are to be given to any patient, we actually tend to give an advice to this patient that take these supplements along with some citrus fruits या फिर नींबू पानी के साथ ले लो ये iron supplements. Okay, this is the advice we actually tend to give. So this question can be what we can indirectly asked in the next examinations also. This question is commonly repeated. Okay, so please remember, iron absorption is facilitated by vitamin C. Okay, so vitamin C का richest source क्या होता है? The richest source of vitamin C would be Indian gooseberries or amlas. So please remember, the richest source of vitamin C would be Indian gooseberries or amlas. Richest source of vitamin D would be halibut fish liver oil. Okay, halibut shark fish liver oil, or you can say just halibut fish liver oil. Okay, and also vitamin A ka bhi, it is the same one, that is your halibut fish liver oil. And vitamin B12, it do not have any plant source, important to be remembered. Okay, it do not have any plant source. Liver is the, or animal meat is the richest source of vitamin B12. Moving further now, next question was a 35-year-old female. Okay, a 35-year-old female patient presents to the OPD with complaints of pain and redness in the great toe. Okay, on investigation, serum uric acid level is 9.6 milligram per deciliter. Normally uric acid levels in the serum should be 0.5 to 1.5 milligrams per deciliter. This is the normal levels of uric acid in serum. Then, apart from prescribing analgesics for relieving pain, the physician prescribed a drug for the long-term treatment. So please remember, as there was pain, he has prescribed analgesics like your NSAIDs, and also along with that, for long-term therapy, he has prescribed some other drug. So which of the following enzyme is likely to be inhibited by this drug which is given for the long-term treatment? So please remember, as we all know, the middle-aged individual presenting with pain and redness in the great toe, and great toe is the most common site for your gout. So please remember, this is a characteristic case of gout. So please remember, here there would be elevated serum uric acid levels, there is hyperuricemia. Okay, grade 2 is the most commonly affected site. Over here, in cases of gout, as we all know, gout is of two types generally, right? So gout is either acute gout and also your chronic gout. Okay, so the drug of choice in cases of acute gout would be nothing but your NSAIDs. So please remember, in cases of acute gout, the drug of choice would be NSAIDs. So acute gout में क्या करते हो तुम you just do the pain relief. Okay, so for pain relief, non-steroidal anti-inflammatory drugs are the drug of choice in cases of acute gout. Whereas in cases of chronic gout, the drug of choice depends, either the person is overproducer or the person is under-excreter. If the person is overproducer, the drug of choice would be allopurinol. Whereas if the person is under-excreter, the drug of choice would be probenecid. So please remember. And as we all know, allopurinol is the drug which inhibits which enzyme? It inhibits xanthine oxidase enzyme. So please remember, it inhibits xanthine oxidase enzyme. So allopurinol, which is given for long-term treatment of gout, it inhibits which enzyme? Xanthine oxidase. And this question has been multiple times repeated in the examination. Guma ke puchta, and this question has been asked. It would like these people would keep asking this question again and again and again. So please remember this, important. Allopurinol inhibits xanthine oxidase. Okay, and all these answers, that dihydrofolate reductase inhibitor. So dihydrofolate reductase inhibitor is your methotrexate, and methotrexate, as we all know, it is a DMARD, that is your disease modifying anti-rheumatoid drug, which is used in cases of rheumatoid arthritis. Moving further, which of the following drug used in the management of episodes of asthma does not act by causing bronchodilation? So important kya hai yahan pe? Does not act by causing bronchodilation. So let's see, all these drugs are used in cases of asthma, right? So please remember, salbutamol, which is a beta 2 agonist, hydrocortisone, which is a steroid, ipratropium bromide, which is an anticholinergic drug, and deriphyllene. Deriphyllene is nothing but your theophylline. Okay, deriphyllene is nothing but your theophylline, which is from the group of methylxanthines. So usually क्या होता है? Theophylline also causes bronchodilation, salbutamol causes bronchodilation, and ipratropium bromide also causes bronchodilation. The only drug that is your steroids, that is hydrocortisone, it acts by decreasing the secretions. As we all know, in asthma क्या होता है? The basic pathology in asthma is a hypersecretion. Okay, there is excessive secretion, excessive mucus secretion, which is causing obstruction in the airways. So hydrocortisone acts by decreasing the secretions. Okay, so please remember option B, hydrocortisone or steroids does not act by causing bronchodilation in cases of asthma. Moving further, a female patient was on warfarin therapy, okay, after prosthetic heart valve implantation. She conceived. Now she is pregnant. So what advice will you give regarding the use of this drug in early pregnancy? So as we all know, in early pregnancy, that is in the first trimester, this is the period for organogenesis. And organogenesis के time पे क्या होता है? We usually tend to avoid the teratogenic drug. And as we all know, among the anticoagulant drug, warfarin or coumadin is the most teratogenic drug. So please remember, the warfarin is to be avoided in the early pregnancy. So options क्या क्या थे यहाँ पे? A, continue warfarin but add vitamin K to the therapy. B, change warfarin to heparin. C, terminate the pregnancy. D, continue warfarin therapy. Anyways, option A is not the right option. Option C, termination is not a choice anyways. Continue warfarin therapy, we cannot risk the pregnancy definitely. Therefore, the answer over here is option B, that is change warfarin to heparin. As we all know, heparin is also an anticoagulant and a safer choice among the anticoagulants. So please remember, we need to change warfarin to heparin over here. Okay, so please remember, warfarin can lead to fetal warfarin syndrome. Okay, warfarin if given during pregnancy, it can lead to fetal warfarin syndrome, and this fetal warfarin syndrome is characterized by multiple bony and skeletal deformities. It is also characterized by impaired intelligence. It is also characterized by microcephaly. Okay, so all these congenital anomalies can be seen if the patient, if the mother is taking warfarin during her pregnancy. Moving further, which of the following oral hypoglycemic agent does not require dose reduction in cases of renal failure? Okay, so इसका directly मतलब क्या है? Which of the following drug can be given in cases of renal failure? ये इसका direct सीधा सीधा मतलब है, right? So options were A, saxagliptin, B, linagliptin, C, sitagliptin, and D, vildagliptin. As we all know, all these gliptin drugs are what? Gliptin drugs are dipeptidyl peptidase 4 inhibitors. So please remember, DPP4 inhibitors होता है ये. Okay, so please remember, out of all these drugs which are given, all of them undergo excretion by kidneys except one, which has minimal renal excretion. And which is the drug which has minimal renal excretion? So please remember, the option over here was your answer is option B, linagliptin. So please remember, linagliptin has the minimal renal excretion. Less than 10% of linagliptin is excreted via kidneys. Okay, so please remember. Otherwise, it is metabolized by conjugation in the liver itself. Okay, so please remember this important one. Therefore, linagliptin is a safer choice which can be given in cases of renal failure, whereas all the other drugs which are mostly excreted by the renal route, they can lead to toxicity if given in cases of renal failure. Moving further, next question was, which of the following drug is the preferred drug for closure of patent ductus arteriosus in a preterm or a premature baby? So please remember, the preferred drug in cases of PDA would be the options were option A, indomethacin, option B, ibuprofen, option C, mefenamic acid, and option D, paracetamol. So as we all know, the drug of choice in cases of PDA closure is nothing but your option A, indomethacin. Yes, some books say that ibuprofen is a better option, but we are not sure. Many of the students have not given recall of ibuprofen was there in the options or not. So please remember, ibuprofen is a safer choice for sure, but as many of them have not given the recall, so indomethacin was a common recall. So please remember, indomethacin is the preferred drug in cases of PDA closure. As we all know, in cases of patent ductus arteriosus, normally prostaglandins are the ones which keep this ductus arteriosus open or patent. So we need to give prostaglandin inhibitors. Okay, so please remember, there's non-steroidal anti-inflammatory drugs which are selective COX-2 inhibitor. Okay, selective COX-2 inhibitor कौन है? Indomethacin. Okay, so it can act against this prostaglandin and lead to the closure of your patent ductus arteriosus. Moving further, the clinical finding of bull's neck shown in the image below is associated with. So please remember, the finding which is given below The characteristic term used over here was bull's neck. So please remember, as we all know, bull's neck is associated with nothing but diphtheria. So please remember, it was a characteristic case of diphtheria. ये image based session में already है तुम्हारे पास. In the image based sessions, the FMG snaps that you guys have, you have already this image which is given along with diphtheria. So please remember, diphtheria is also a very common question asked from microbiology every year. Either the arrangement is asked or some clinical case is asked from diphtheria every year. Okay, so please remember, bull's neck is associated with diphtheria. और bull's neck क्यों होता है? Because there is cervical edema and there is cervical lymphadenopathy. Okay, there is cervical edema and there is cervical lymphadenopathy, which leads to this diffuse neck swelling known as bull's neck in cases of diphtheria. So please remember. Okay, Ludwig's angina would be a what we can say, a focal neck swelling. It is due to infection of the submandibular gland. Okay, and measles and mumps. Measles is anyways ruled out. Mumps के साथ बहुत सारे बच्चे कंफ्यूज हो गए थे. So please remember guys, mumps leads to parotitis. Yes, mumps का basic pathology क्या होता है? There is parotitis, inflammation of your parotid gland. So there would be swelling over the cheek. Okay, it would not be a diffuse neck swelling. So please remember, the option here was A, that is your diphtheria was the right answer over here. Moving further, next question. A 10-year-old male African child, I'm not sure if African was given in the answer, some students have given the recall. A 10-year-old male African child presents with a progressive jaw swelling along with chronic weight loss. Okay, a FNAC was ordered, that is your fine needle aspiration cytology, and the histopathological examination reveals starry sky appearance, very characteristic, which is shown in the image below. What is the most likely translocation? Now some people are giving the recall that the diagnosis was asked, some people are giving the recall the translocation was asked. So please remember, this is a characteristic case of kaun sa hai ye case? So please remember, 10-year-old male child. Okay, so first decade of life. Okay, progressive jaw swelling. This progressive jaw swelling is characteristic of cervical lymphadenopathy. Okay, along with chronic weight loss, which is suggestive of malignancy. Chronic weight loss normally are seen in cases of malignancies, like cachexia दिखता है हमें. So this is a case of some malignancy where there is cervical lymphadenopathy. FNAC में क्या दिख रहा है? This is the typical starry sky appearance which is seen, and as we all know, this is a classical case of Burkitt's lymphoma. This is a classical case of Burkitt's lymphoma. So please remember, in cases of Burkitt's lymphoma, which is the translocation which is associated. So please remember, it is a translocation 814. Okay, so we have already discussed in the class previously. Burkitt's lymphoma में क्या होता है? All the 8s are associated. So please remember, 822, translocation 814, all these 8s are associated with Burkitt's lymphoma. So please remember, translocation 814 is associated with Burkitt's lymphoma. Okay, important one. Translocation 922 is known as your Philadelphia chromosome. Important one to be remembered. So telling you. So please remember, translocation 922 is nothing but your Philadelphia chromosome, which is associated with chronic myeloid leukemia. Okay, Philadelphia chromosome is associated with chronic myeloid leukemia. Okay. Moving further, a 19-year-old female presents with a midline neck swelling. Okay, which is most probably a thyroid swelling. Midline neck swelling matlab. A biopsy was ordered which shows presence of a thyroid malignancy, showing orphan ani nuclei appearance. Now this is very much characteristic. The same question has been asked in the August examination also, and the same question was repeated in this session as well. So please remember, this is a very common topic from which questions have been asked repeatedly. So please remember, don't ever forget to read thyroid cancers. Okay, so most likely diagnosis is, so as we all know, this is a thyroid malignancy, और ये यहाँ पे जो nucleus दिख रहा है without any nucleoli. So please remember, empty nucleus without any nucleoli are characteristic of this orphan ani nuclei appearance. Okay, cartoon था orphan ani. So please remember, उसके आँखों जैसा दिखता है ये. Orphan ani nuclei appearance of nuclei is seen in cases of none other than option A, papillary carcinoma of thyroid. It is seen in cases of option A, papillary carcinoma of thyroid. So papillary carcinoma का question August में भी था, यहाँ भी था. So orphan ani nuclei is very much characteristic of papillary carcinoma of thyroid. Also, in cases of papillary carcinoma of thyroid, we can see psammoma bodies. Important one. Okay, so psammoma bodies are also seen in cases of papillary carcinoma of thyroid. Okay, so important one to be remembered. Whereas anaplastic carcinoma of thyroid, okay, anaplastic carcinoma of thyroid has the worst prognosis among all the thyroid cancers. Anaplastic carcinoma of thyroid has the worst prognosis among all the thyroid cancers. Okay, important one. Whereas papillary carcinoma of thyroid, यहाँ पे risk factor क्या होता है, कभी कभी cases में एक risk factor दिया होता है which helps you diagnose. Okay, so please remember there would be a risk factor of long-standing thyroglossal cyst. There would be a risk factor of long-standing thyroglossal cyst, okay, given in cases of papillary carcinoma of thyroid, or also a long-standing toxic nodular goiter. Whereas if there is a long-standing history of radiation exposure, that is associated with follicular carcinoma of thyroid. Moving further. Now, an adult male presented to the medicine OPD with right hypochondriac pain, icterus and tremors. On examination, a brownish ring is observed in the eye as shown in the image below. The most likely genetic alteration which is associated with this condition is. So यहाँ पे कुछ लोग बोल रहे हैं there was just symptoms like right hypochondriac pain and icterus given. Some people say there was a history of chronic liver disease. Okay, any of this option is fine. Okay, so please remember if there is right hypochondriac pain or icterus, this is suggestive of hepatitis, right? Icterus है मतलब jaundice है, right? So this is suggestive of hepatitis or any of the liver diseases, along with tremors. Okay, so tremors, or we can say bradykinesia or rigidity associated with a liver disease. So please remember this is resembling, so these CNS symptoms like tremors, bradykinesia and rigidity will resemble what? These will resemble Parkinsonism. But now they are also associated with this liver disease. So if there is liver disease associated with Parkinsonism symptoms, then the diagnosis would be your Wilson's disease. Then the diagnosis becomes Wilson's disease. As we all know, Wilson's disease is also known as hepatolenticular degeneration. Hepato, liver, lenticle means basal ganglia, उन दोनों का degeneration. In Wilson's disease, there is excess of copper. As we all know, there is excess of copper deposition. So this excess copper deposits in the basal ganglia, also in the liver, leading to all these symptoms. Okay, and it also deposits in the descendants membrane of cornea. Leading to this characteristic ring known as KF ring. So this, if copper deposits in the descendants membrane of cornea, this leads to this appearance KF ring or Kayser-Fleischer ring, which is seen in cases of Wilson's disease. So which is the genetic alteration associated with Wilson's disease? So your answer is option A. Okay, so please remember ATP7B gene. Okay, so ATP7B gene mutation is associated with Wilson's disease, whereas ATP7A gene mutation is associated with Menkes disease. ATP7A gene mutation is associated with Menkes disease. उसका केस कैसे होगा? There would be brittle, kinky hair, okay, sparse hair on the forehead, okay, like this the patient would present, and this is a case of copper deficiency. Menkes is a case of copper deficiency. Okay, CFTR gene is associated with cystic fibrosis, and APC gene with, it is associated with familial adenomatous polyposis. So ATP7B gene mutation, ATP7B is located on 13 number chromosome. This can also be a potential question. Moving further, a cardiac biopsy shows the presence of apple green birefringence on polarizing microscopy with application of the Congo red stain. What is the most likely diagnosis? As we all know, Congo red stain is most commonly used for which substance? It is most commonly used for your amyloid. So please remember, and the images which are given below, the first image over here, there is a normal light. Okay, under normal light, if we see the cardiac biopsy, we can see pink red appearance of the amyloid. Whereas under polarized microscopy, we can see this characteristic apple green birefringence of amyloid. So this is the characteristic case of option C, cardiac amyloidosis. Please remember. Moving further now, a 52-year-old female presents with breast lump. Okay, a 52-year-old female presents with breast lump showing the following pattern on histopathological examination with presence of signet ring appearance and mucin deposition. So the most likely diagnosis is, I feel they have already given a very big clue, signet ring appearance. So please remember, signet ring appearance is characteristic of which breast cancer? It is characteristic of your invasive lobular carcinoma. So please remember, signet ring appearance is characteristic of invasive lobular carcinoma. Signet ring मतलब इस तरह का कुछ appearance होता है. Okay, so please remember there are eccentric nuclei which is present. Okay, so over here you can see some cells. See over here, these look like a ring, and these are known as your signet ring appearance. Okay, and there is also mucin deposition, and this invasive lobular carcinoma is usually bilateral. Okay, it affects both the breasts. It is bilateral and it shows the typical India file pattern. It shows the typical India file pattern, that the cells are discohesive and arranged in this pattern. Okay, this is known as your India file pattern of cells, which is seen in cases of invasive lobular carcinoma. Okay, important one. Signet ring की अगर हम बात करें, so signet ring appearance or signet ring cells or is also seen at some other sites. So signet ring appearance, if we say on HRCT scan, signet ring appearance on an HRCT scan is seen in cases of bronchiectasis, whereas signet ring cells on histopathological examination are seen in cases of gastric cancer. It is also seen in invasive lobular carcinoma of breast. Also they are seen in cases of gastric cancer. And gastric cancer अगर ovary में metastasize होता है तो Krukenberg tumors में भी दिखता है हमें. Okay, so please remember in which ovarian tumor we can see signet ring cells? Krukenberg tumor. They are also seen in gastric cancer, invasive lobular carcinoma, and signet ring appearance on HRCT is seen in cases of bronchiectasis. Moving further, a HIV positive patient presents with watery diarrhea. Important क्या है? HIV positive है, presents with watery diarrhea. Okay, what is the most likely causative agent? They have also given an image which is suggestive of a oocyst. ठीक है? But anyways, if you don't even know this image, just don't consider it. तो भी हमें क्या पता है कि in HIV positive individuals or people living with HIV/AIDS, the most common cause of diarrhea is nothing but your Cryptosporidium parvum. So please remember, the most common cause of diarrhea in cases of immunocompromised individuals as in HIV/AIDS, it is your Cryptosporidium parvum. So please remember, answer over here is option B, Cryptosporidium parvum. Okay, oocysts दिए हुए हैं and oocysts are very smaller in size. The size is 2 to 6 microns. Important. Moving further now, a patient presented with diarrhea. Okay, a patient presented with diarrhea. The following trophocyte was observed in stool examination under the microscope in the image. What is the causative organism? So this is the trophocyte of characteristic teardrop shaped or monkey face shaped. Okay, or tennis racket shaped you can say. Okay, so this is the characteristic trophocyte of nothing but your Giardia lamblia. So please remember, the answer over here was Giardia lamblia. This is a characteristic trophocyte of Giardia lamblia, which is a very common cause of diarrhea. Okay, it is a very common cause of diarrhea. Entamoeba histolytica, it is very much important. It can lead to intestinal amoebiasis and it leads to the characteristic flask shaped ulcers. It leads to the characteristic flask shaped ulcers. It is characteristic flask shaped ulcers in cases of intestinal amoebiasis, whereas if there is hepatic amoebiasis due to Entamoeba histolytica, it can lead to the characteristic presence of uncovy sauce pus in liver. It can lead to the presence of uncovy sauce pus in cases of hepatic amoebiasis. Okay, important one, remember this. Okay, giardia के बारे में और एक क्वेश्चन क्या पूछा जा सकता है from microbiology? So please remember, for giardia the question which can be asked is about its motility. So please remember, giardia presents with the falling leaf like motility. Giardia presents with falling leaf like motility. Important one. Moving further guys, now a woman came to the OPD with complaints of constipation, obesity and cold intolerance. So इन तीनों सिम्टम्स से थोड़ा बहुत क्या पता चल रहा है? कॉन्स्टिपेशन है, ओबेसिटी है, फैट फीमेल who is constipated, who has cold intolerance. This is a characteristic case of hypothyroidism. This is a characteristic case of hypothyroidism. Okay, so the blood examination further reveals anti-TPO antibodies. And what is TPO? That is your thyroid peroxidase enzyme. What is TPO? That is your thyroid peroxidase. So there are antibodies which are formed against this thyroid peroxidase enzyme, which is the rate limiting enzyme of thyroid hormone synthesis. So please remember, if the antibodies are formed against this thyroid peroxidase enzyme, definitely the thyroid hormone synthesis would be impaired. Then it would lead to decreased T3 and T4 levels. So this is a case of hypothyroidism. You can come to a conclusion from this also. Now they are asking the most likely diagnosis is. So please remember, option A, it is Graves' disease, which is the most common cause of hyperthyroidism. It is ruled out. Next one, follicular carcinoma of thyroid. No, this is not a case of carcinoma. D, it is toxic nodular goiter. Again, it would present as mostly hyperthyroidism commonly. So this is also ruled out. So please remember the answer over here is option B, Hashimoto's thyroiditis, which is the most common cause of hypothyroidism in India. Please remember, the most common cause of hypothyroidism in India, if asked, it is your Hashimoto's thyroiditis. Whereas the most common cause of hypothyroidism worldwide, if asked, then the answer becomes endemic goiter. The answer becomes iodine deficiency or endemic goiter. Okay, please remember this. Moving further. Next question. An elderly female presents to the OPD with excessive stretchability of skin and hyper flexible joints. The most likely diagnosis is, options are A, Ehlers-Danlos syndrome, option B, Duchenne's muscular dystrophy, option C, Becker's muscular dystrophy, option D, SLE. Please remember the answer over here is nothing but your congenital disease, which is your Ehlers-Danlos syndrome. Please remember there is excessive stretchability of skin and there is hyper flexible joints also. Okay, it is a collagen defect. It is your collagen defect. The next one, Duchenne's muscular dystrophy or Becker's muscular dystrophy, which are nothing but your muscular dystrophies associated with dystrophin gene mutation, important. Moving further, a pregnant female was diagnosed with mild depression. The preferred line of treatment is, यहाँ पे important क्या है कि pregnant female है, mild depression है. So as we all know, in cases of mild depression, as this is a first episode that the female is presenting with, some people have said that the first episode was mentioned in the question. If not, we can assume it as the first episode because there is no history which is given in the question. So a first episode of mild depression, normally the preferred therapy is only psychotherapy, that is your cognitive behavioral therapy. Yes, if asked the best therapy, definitely it is a combination of your psychotherapy, that is cognitive behavioral therapy, along with your pharmacotherapy with antidepressants. But the first episode, the first line management would be cognitive behavioral therapy only. Upar se, the female is also pregnant. Therefore, we tend to avoid antidepressants or any of the drugs for that matter during pregnancy, right? So it's better. The option would be option A, cognitive behavioral therapy. CBT is the preferred management in this case. Okay. Moving further, guys. Okay, and one more important thing, ECT, that is your electroconvulsive therapy. Electroconvulsive therapy is used in cases of depression only when there is a severe depression associated with suicidal thoughts or suicidal attempts. Please remember, in cases of severe depression along with suicidal attempts, the treatment of choice becomes your ECT, that is your electroconvulsive therapy. Next question is, a person presented with the following nail finding, what is the first line therapy used? So ये nail finding क्या दिख रही है, यहाँ पे pitting of nails दिख रहा है थोड़ा, ठीक है, there is pitting of nails, and this pitting of nails is what characteristic, कैसा दिख रहा है appearance? This are your spoon shaped nails. कैसे दिख रहे हैं ये? These are your spoon shaped nails, and spoon shaped nails are known as koilonychia. Spoon shaped nails are known as koilonychia. Okay, and koilonychia is associated with which anemia? ये pallor भी दिख रहा है, देखो हाथों में. There is also pallor associated. And koilonychia, as we all know, it is associated with which disease? It is associated with iron deficiency anemia. So please remember, the answer over here should be option C. Iron supplements are given in this case. Okay, iron supplements are given. Moving further, a 30-year-old male patient presented with knee pain. Okay, please important, age group हमेशा important होता है, sex हमेशा important होता है. You need to consider it in all the clinical cases. So a 30-year-old male patient presented with knee pain and swelling near the knee joint. The X-ray of the patient is given in the below image, which shows presence of an expansile lytic bone lesion extending from the epiphysis to the metaphysis. The histopathological examination shows presence of giant cells along with stromal cell predominance. What is the most likely diagnosis? So please remember, the similar kind of question was also asked in the August examination. So as we all know, again, there are very commonly repeated questions which come in the FMGE examination. So please remember this. ठीक है, so ये एज ग्रुप क्या है? 30-year-old male है, ठीक है, हम बोन ट्यूमर्स की बात कर रहे हैं. 30-year-old male, so we need to look that in adult age group, that is 20 to 40 years of age group, कौन सा बोन ट्यूमर कॉमन है. ओके, Knee is the most common site. Like one of the common sites for this tumor is your knee joint. इसलिए याद रखना हमेशा common sites दी जाती है question में. Okay, so knee joint is a very common site for this case. Then X-ray पे क्या दिख रहा है? In this X-ray we can see the upper end of the tibia is affected. Okay, and upper end of the tibia is a common site for many of the epiphyseal tumors. So यहाँ पे epiphyseal, and they are also given in the question that this tumor is extending from the epiphysis to the metaphysis, and there are mainly two epiphyseal tumors that you need to remember, that are your giant cell tumor and next one is your chondroblastoma. Okay, so giant cell tumor and chondroblastoma are the two common epiphyseal bone tumors. Okay, and one more epiphyseal lesion which is not a tumor but it is an epiphyseal lesion. It is your ABC, that is your aneurysmal bone cyst. But anyways, aneurysmal bone cyst is already ruled out and there is no option as aneurysmal bone cyst also, so anyways we can rule it out easily. Then the options left are giant cell tumor and your chondroblastoma. यहाँ पे क्या दिख रहा है? In X-ray you can see this characteristic soap bubble appearance. इस X-ray में क्या दिख रहा है? The characteristic soap bubble appearance is seen. ठीक है, soap bubble जैसा appearance दिख रहा है. Okay, and along with that, on the histopathology they have already mentioned that there are these giant cells which are seen, and there is excessive stromal cells or stromal cells predominance is seen in this case. So please remember, giant cells on histopathology and the soap bubble appearance on an X-ray are very much characteristic of nothing but your giant cell tumor, which is very common in the 20 to 40 years of age group. Giant cell tumor is also known as osteoclastoma. It is also known as your osteoclastoma. Important cheez yaad rakhni. Okay, so please remember this. It is very much important. It is an epiphyseal tumor which starts in the epiphysis, extends up to the metaphysis. It presents on an X-ray as a soap bubble appearance, on histopathology with giant cells and stromal cell predominance. Okay, so it is very common, and the most common site for your giant cell tumor, it is your upper end of your tibia, the distal end of your femur and the distal end of your radius. These are the most common sites for your giant cell tumor. Ewing sarcoma की केस होती तो the first decade of life is the most common age group when Ewing sarcoma is actually seen in patients. Ewing sarcoma में क्या दिया जाता? Onion peel appearance would have been given, and also infection, fever वगैरह दिया जाता. Osteosarcoma में there would be Codman's triangle which can be seen on an X-ray. Codman's triangle or the sunburst or the sun ray appearance can be seen. Okay, important one. And osteoid osteoma and Ewing sarcoma, both of these are your diaphyseal tumors. यहाँ पे तो ये epiphyseal था, so anyways these options were ruled out easily. Okay. Osteosarcoma is also your metaphyseal tumor. So anyways, this also option was ruled out easily. Moving further, a child presented to the casualty with intense headache, vomiting episodes and neck stiffness. As we all know, headache, vomiting and neck stiffness or neck rigidity. This is a classical triad of what? So please remember, this is a classical triad of which disease? This is a classical triad of meningitis. याद रखो. This is a classical triad of meningitis. Important. So a lumbar puncture was performed. CSF analysis shows the presence of neutrophils, elevated proteins and decreased glucose levels. The gram stain shows the presence of the following organism in this image, which is the most likely causative agent. So for meningitis there is a catch. Okay, there are three types of meningitis usually, that is your bacterial meningitis, tubercular meningitis and viral meningitis. If we see the CSF protein, so CSF proteins would be elevated in all these three. Okay, so CSF proteins are elevated in bacterial, tubercular and viral meningitis, all the three. If we then check for your CSF glucose, so CSF glucose is mainly used by bacteria, right? So CSF glucose would be decreased in cases of bacterial and tubercular meningitis, but it would be normal in cases of viral meningitis. So this option was ruled out. Okay, anyways, then moving further, इन्होंने और क्या दिया है? There is presence of neutrophils. So we see cells. Okay, we see cells. Normally CSF में क्या होता है? We can see lymphocytes. Okay, normally in CSF we can see lymphocytes which are 0 to 5 in number. Normally बता रहा हूँ मैं. ठीक है. In cases of bacterial meningitis, there would be excess levels of cells, but they would be your neutrophils. Okay, elevated cells would be then, huge number of cells would be found, but these would be your neutrophils. Tubercular meningitis में क्या देखेगा? There would be excess level of lymphocytes, matlab there would be 80, 100, 200 number of lymphocytes which can be seen in the CSF. And viral meningitis may also there is lymphocytic predominance, but they are only 10 to 15, 20. Okay, they are not usually elevated. They are elevated but not like they are in moderation. So this is the catch, okay, how to differentiate between different types of meningitis. So यहाँ पे हम क्या diagnosis ला सकते हैं? CSF protein elevated है, CSF glucose decreased है, and cells are increased. And which are the cells? They are your neutrophils. So please remember, the diagnosis is your bacterial meningitis, and the common causes of bacterial meningitis are your Neisseria meningitidis and Streptococcus pneumoniae. But in the given picture over here, can you see like these rod-like these what we can see, there's string-like structures. So string-like structures are not seen, therefore Streptococcus pneumoniae is ruled out. You can see a kidney-shaped organism, and this kidney-shaped organism is nothing but your option A, Neisseria meningitidis. It is your Neisseria meningitidis, please remember, also known as meningococcus. Meningococcus can also be associated along with meningitis with some petechial rashes all over the body, with some fever, okay, so please remember this. Then Cryptococcus neoformans is a common cause, or rather the most common cause of meningitis in HIV positive individuals. So please remember, HIV positive individuals mein the most common cause of meningitis is your cryptococcal meningitis, okay, and herpes simplex virus is a common cause of encephalitis, okay. Moving further, what is the mechanism of defect seen in cases of xeroderma pigmentosum? In cases of xeroderma pigmentosum, option A, base pair excision gene defect, option B, mismatch repair gene defect, option C, homologous recombinant gene defect, option D, trinucleotide repeat expansions. So please remember, xeroderma pigmentosum is a disease associated with DNA repair gene defect, okay, it is associated with DNA repair gene defect. So DNA repair की ये तीनों भी genes है, okay, so please remember. So the correct answer over here is option A, base pair excision gene defect, or you can also call it as nucleotide excision gene defect. Base pair or nucleotide excision gene defect is the basic pathology in cases of xeroderma pigmentosum. Xeroderma pigmentosum, it has autosomal recessive pattern of inheritance. It is associated with multiple skin malignancies, ठीक है, और पूरी body पे छोटे छोटे melanotic spots होंगे, okay. Then mismatch repair gene defect is associated with HNPCC. Mismatch repair gene defect is associated with hereditary non-polyposis colon carcinoma, okay, and homologous recombinant gene defect is associated with Bloom syndrome and ataxia telangiectasia. It is associated with Bloom syndrome and ataxia telangiectasia. Please remember this. Then trinucleotide repeat expansion, the CAG repeats are associated with Huntington's chorea, okay, important ones. So these are the things you need to remember. Moving further, guys, now the splint in the given image is used for. So the splint given in the image, यहाँ पे क्या दिख रहा है? There are two shoes which are kept at a distance. Okay, they are maintained at a distance by this bar which is connecting them, and this is a characteristic Dennis-Brown splint. This is a characteristic Dennis-Brown splint. Okay. So please remember, this is a characteristic Dennis-Brown splint, and as we all know, Dennis-Brown splint is used in cases of CTEV, that is your congenital talipes equinus varus. Okay, CTEV के cases में क्या करते हैं हम? Which splint is used? It is your Dennis-Brown splint which is used in cases of CTEV. Okay, so CTEV में और एक question पूछा जा सकता है. CTEV is a congenital anomaly. The sequence of correction. So the sequence of correction, there are multiple deformities in cases of CTEV, right? So the sequence of correction is your C goes for cavus, A goes for your adduction, V goes for your varus, and E goes for your equinus. So this is the sequence of correction in cases of CTEV, and these are corrected by Ponseti plasters. Okay, so Ponseti's plasters are, there are repetitive plasters. Every 5 to 7 days we change the plasters. Okay, and so the sequential plasters, almost 7 to 8 times the plasters are changed, and then we give this CTEV shoes, CTEV splint, that is your Dennis-Brown splint, for almost 3 months, and after that we recommend the CTEV shoes. Okay, so this is the treatment in cases of CTEV. Foot drop के लिए क्या use करते हैं हम? We use the foot drop splint, or also known as your AFO, that is your ankle foot orthosis. Foot drop कब होगा? In cases of common peroneal nerve injury. Okay, please remember this. Femur fracture में कौन सा splint use करते हैं? Femur fracture we use the Thomas splint. Okay, or also the Bowler's Brown splint. Okay, BB splint. Moving further, a farmer from Tamil Nadu presented with the foot swelling. Okay, important क्या है कि एक farmer है, then he is from Tamil Nadu, which is an endemic region, presented with foot swelling with multiple discharging sinuses, the most likely diagnosis of the below given images. So यहाँ क्या दिख रहा है? This is the image was given. This image has been asked prior as well. Okay, so please remember this. So क्या दिख रहा है? Growth दिख रही है, tumorous growth types लग रहा है कुछ, infection है and multiple discharging sinuses है जिसमें से पस बाहर आ रहा है. So this is a characteristic case which is seen in farmers mostly in the state of Tamil Nadu, and this is a case of your Madura foot, also known as Madura mycosis. Okay, it can be caused by two organisms. Either it can be caused by a bacteria. If it is caused by a bacteria, it is known as actinomycetoma, and if it is caused by a fungus, then it is known as your eumycetoma. So please remember, Madura foot or Madura mycosis either can be a actinomycetoma or a eumycetoma. Okay, so this is a classical case of Madura foot. Athlete's foot is nothing but it is a tinea pedis. If your tinea infection affects your foot, then it is known as your athlete's foot, which is commonly seen due to the excessive moisture that the athletes keep on wearing the shoes for a longer period of time, that predisposes to this infection of tinea, known as tinea pedis, also known as athlete's foot. Okay, and sporotrichosis, many people confuse it with this sporotrichosis. Please remember, sporotrichosis is seen in barefoot. Yes, it is very right that it is seen in barefoot individuals who walk barefoot. Okay, mostly at the what we can say around and in and around the Himalayas. Please remember, ये classical case कैसी होगी? In and around the Himalayas or in a gardener. Okay, so please remember, sporotrichosis case would mostly present as a thorn prick injury. Okay, so important one. The next one, a child presented as in the following image. What is the most likely deficiency in this child? ये characteristic child जो दिख रहा है, it is a malnourished child. Okay, this is a malnourished child, as we all know. भले दिख नहीं रहा, it is a malnourished child. Okay, and the options are A, only proteins, B, proteins plus calories, C, calories only, D, carbohydrates. So please remember, this is a malnourished child, and malnutrition के दो important causes कौन से हमारे पास? One is your kwashiorkor and the second is your marasmus. Okay, and the second is your marasmus. So please remember, in cases of kwashiorkor, there is only protein energy malnutrition. It is only protein deficiency is there. Okay, in cases of kwashiorkor, there is only protein deficiency, and protein deficiency जिसकी वजह से क्या होता है? There is decreased plasma oncotic pressure leading to this edema. Okay, so please remember, ये जो दिख रहा है ना पूरा ascites वगैरह, all this edema which can be seen, it is due to this protein deficiency in cases of kwashiorkor. Whereas in marasmus there is protein plus calorie deficiency. In cases of marasmus there is protein plus calorie deficiency. In marasmus we can see a wasting features. We can see wasting features. पूरे rib cage prominent होगा, monkey like face होगा. Okay, that can be seen in cases of marasmus. Whereas in kwashiorkor there would be a distended abdomen due to this edema. There can be a facial swelling, puffy moon-like face can be there. There would be sparse hairs. Okay, all these can be seen in cases of kwashiorkor. So the answer over here was option A, only protein deficiency. Next one, a 70-year-old male patient presented with low back pain. The skull X-ray had multiple lytic lesions. Skull X-ray, multiple lytic lesions. Already a diagnosis, and the below given histopathological picture was seen on bone marrow aspiration. What is the likely diagnosis? So as I've already told you, this disease is commonly repeated in the examination. A similar kind of question again was asked in the August examination also. Okay, so the patient is presenting with low backache. मतलब क्या? Spine is affected. Okay, आगे क्या बताया गया कि skull में there are multiple lytic lesions. So important osteolytic lesions दिख रहे हैं, and the histopathological picture is also given. Okay, so histopathological picture में क्या दिख रहा है? This characteristic cell is seen, and this characteristic cell where there are grape-like inclusion. Okay, so this grape-like inclusions which are seen over here, it is characteristic of which cell? These are characteristic of Mott cells. So याद रख लो. So this grape-like inclusions are seen in nothing but they are seen in your Mott cells. Okay, so this is a characteristic picture of Mott cell which was also asked in the August examination prior. Okay, and as we all know, Mott cells, multiple lytic lesions on the skull X-ray, also known as your raindrop skull. Okay, so these are all associated in an elderly male, are associated with your option A, multiple myeloma. So the answer over here was option A, multiple myeloma. So I have already told you multiple myeloma is a very commonly repeated topic. Okay, multiple myeloma में क्या होता है? There is a plasma cytosis. In multiple myeloma there is plasma cytosis. Okay, more than 10% of plasma cells would be seen. More than 10% of the plasma cells are seen in the bone marrow. Okay, along with some other features. Okay, lytic lesions would be seen. There can be some kidney impairment which is seen. Okay, Eosinophilic granuloma में also we can find a single multiple lytic lesion on the skull, and that is known as your geographic skull. Okay, that is known as your geographic skull, and that mostly affects your children. So eosinophilic granuloma mostly affects your childhood age group. Important. Moving further to your next question, SLE patient, important, SLE patient presenting with features suggestive of endocarditis and presence of small and medium-sized sterile vegetations were confirmed on echo on both sides of the heart valves. On both sides of the heart valves. This is characteristic of which of the following type? So as we all know, there are different types of endocarditis. In cases of SLE, we can directly come to a diagnosis which is the endocarditis which is associated with SLE patients. As we all know, it is your option B, Liebman-Sachs endocarditis. Okay, one more feature that is suggestive of Liebman-Sachs is your this one, that is small medium-sized sterile vegetations are seen. Okay, so please remember, sterile vegetations are seen at two places. First is your SLE and second is your Marantic endocarditis. Okay, Marantic is a non-bacterial thrombotic endocarditis, non-infectious endocarditis which is associated with malignancies. Marantic endocarditis is associated with malignancies, please remember. But already they have given an SLE patient, so the sterile vegetations if seen in an SLE patient, they are suggestive of Liebman-Sachs endocarditis, please remember. Okay, and if there are friable vegetations, then these are on the upper surface of the valves, then these are suggestive of infective endocarditis. And infective endocarditis पे question था already in August examination. There was splenomegaly and portal hypertension के features दिए हुए थे. Okay, so these are friable vegetations, means easily breakable, which can get dislodged, go to somewhere else and cause a embolism over there. Okay, so this are seen in cases of infective endocarditis. And rheumatic heart disease में the most common site of valvular involvement is your commissural ends. Okay, जो commissura होते हैं ना, these are the ends which are getting involved in cases of rheumatic heart disease for vegetations. Okay, most important. Moving further to your next question, again a repeat question from August examination. A child presented with history of fever, fatigue. On examination there is pallor and petechiae all over the body, along with hepatosplenomegaly on palpation with some sternal tenderness. Which of the following condition explains the child's symptoms? And this is the bone marrow picture which was given. Okay, so please remember, यहाँ क्या क्या दिख रहा है? Fatigue and pallor. Both are characteristic of what? Both are characteristic of anemia. Next one, fever. Fever is characteristic of some infection which is due to some leukopenia. Okay, there can be leukocytosis or there can be leukopenia. So over here there is leukocytosis. ठीक है? So there is leukocytosis, there is an infection, fever is associated. And lastly, petechiae, मतलब there is also platelet defect. There is also platelet defect due to this petechiae. So मतलब तीनों blood cells affect हो रहे हैं. Okay, important one. Along with that क्या दिख रहा है हमें? Hepatosplenomegaly है. Okay, the hepatosplenomegaly means reticuloendothelial cells are hypoplasia is there, and also there is sternal tenderness. And bone marrow examination पे क्या दिख रहा है? यहाँ पे ये बड़े-बड़े cells दिख रहे हैं. And what are these cells? These are nothing but your lymphocytes. So please remember, a large spherical nucleus which is almost acquiring the circumference, okay, that are nothing but your lymphocytes. Okay, that are nothing but your lymphocytes. ऐसी similar दिखने वाले होते हैं तुम्हारे monocytes, but they have a kidney shaped nucleus. So this is the differentiating feature. Okay, and how you can differ it, how this differs from acute myeloid leukemia. So please remember, in acute myeloid leukemia, in cytoplasm you can see these rod shaped structures which are known as OR rods. Okay, those are known as OR rods, but they are not seen in cases of acute lymphoid leukemia. So please remember, this is a characteristic case of acute lymphoblastic leukemia, ALL, which is the most common malignancy in children. So in case अगर question पूछा जाए which is the most common malignancy in children, the answer should be ALL, that is your acute lymphoblastic leukemia. Please remember, क्या कैसे diagnose करा? Sternal tenderness है, मतलब there is hypoplasia of the bone marrow, along with it there is hepatosplenomegaly, hypoplasia of the reticuloendothelial cells due to excessive destruction, and lastly there is anemia, leukocytosis and platelet defect. Okay, and in a child, therefore it is a case of acute lymphoblastic leukemia. As we all know, chronic myeloid leukemia is common in 60 to 70 years of age group. Okay, moving further, a 17-year-old tall male, okay, important, a young teenager, tall male, presented with complaints of gynecomastia, okay, that is breast enlargement. On examination he had absent pubic hair, okay, that is secondary sexual characteristic are somewhat absent, and a feminine voice, again same, as their secondary sexual characteristic are not well developed, therefore there is a feminine voice. His genetic analysis showed the presence of a bar body. Usually we know if it is a male, the karyotype is 46XY, alright. So bar bodies क्या होता है? Bar bodies are the inactivated X chromosomes. Those are your inactivated X chromosomes. And उसका क्या है formula? Number of X chromosomes minus 1. In males, how many X chromosomes we have? 1. 1 minus 1 is 0. So normal males में the number of bar bodies is 0. But in cases of Klinefelter syndrome, as there is double XY, okay, 47XXY is the karyotype, therefore there would be one bar body present in cases of Klinefelter syndrome. So what is the likely diagnosis over here? As we all know, a young male presenting with gynecomastia, who is tall in height, okay, pubic hairs or secondary sexual characteristics are absent, genetic analysis shows bar body. This is a very characteristic case of your option A, Klinefelter syndrome. Please remember this. Turner syndrome, anyways, it is ruled out easily because it is a male. Turner syndrome, it is a female which is presenting to you. The karyotype is 45XO. So please remember, यहाँ से इन syndrome से आसपास एक ना एक question तो पूछा ही जाता है हर बार. Okay, always at least one question is asked in and around these syndromes. Okay, Turner was a very common one. Now they have asked one question on Klinefelters. Okay, so 45XO is the karyotype of Turner syndrome. There is short stature. In Turner syndrome females, there would be streak gonads, that is streak ovaries would be seen. There would be a low posterior hairline. There would be a webbed neck, and there would be a shielded chest, or we can say widely spaced nipples would be there, and a flat chest is seen. Okay, and there would be primary amenorrhea seen in cases of Turner syndrome. Whereas in cases of Noonan syndrome, this is a male again. Okay, this is a male with a normal karyotype, but over here the male would be short in stature. So stature कैसा है? Short है, मतलब again ruled out option because here there is a tall male. So there is a short stature male. Okay, please remember there can be somewhat intellectual impairment which can be seen in cases of Noonan syndrome, whereas intelligence is perfectly normal in cases of Turner syndrome. याद रखना important है. Okay. Then next, Sware syndrome. Sware syndrome is very important. 46XY is the karyotype of Sware syndrome, and in this there would be a male who is presenting to you, and there would be also streak testes or streak gonads would be seen, and there would be a what we can say, a female external genitalia. A female external genitalia is seen in cases of Sware syndrome. So please remember, Sware syndrome would be 46XY karyotype, a male presenting to you with female external genitalia and streak gonads or streak testes. Moving further. Next, a young male patient came with complaints of abdominal pain mainly on the left side, that is your descending colon is affected. A colonoscopy was planned as there was a family history of colon cancer. So the endoscopic picture is given below. What is the probable diagnosis? ये है तुम्हारी endoscopic picture. What you can see in this endoscopic picture, what are these? These are your multiple polyps. Okay, these are all your multiple polyps. And कितने दिख रहे हैं? They are more than almost 100. ठीक है, 100 से भी ज़्यादा दिख रहे हैं. Many polyps can be seen. Okay, so please remember, and more than 100 adenomatous polyps. More than 100 adenomatous polyps seen on a colonoscopic picture are very much characteristic of option B, familial adenomatous polyposis. So the answer over here was FAP, that is option B, familial adenomatous polyposis, which is due to APC gene mutation, that is adenomatous polyposis coli gene mutation located on the 5th chromosome. This question can be asked. Okay, APC gene on 5th chromosome which undergoes mutation leading to familial adenomatous polyposis, and this leads to colon cancer in 100% of the cases. Okay, please remember this. HNPCC we have already discussed about it. Mismatch repair gene defect होता है उसमें. Okay, colon cancer ये हो नहीं सकता. There is no as such a huge tumorous growth which can be seen over here. And Peutz-Jeghers syndrome, there are multiple hematomatous polyps. Okay, non-malignant hematomatous polyps which are seen in Peutz-Jeghers syndrome, along with the melanosis which is seen. Okay, blackish color pigmentation दिखता है in and around the lips. So perioral melanosis is seen in cases of Peutz-Jeghers syndrome, and STK11 gene mutation is seen in Peutz-Jeghers. STK11 gene mutation. Moving further, an elderly male develops hematuria. Elderly male develops hematuria and also complains of frequency and urgency. मतलब all these are bladder symptoms. Okay, you can suspect any bladder pathology. He has been working in a dye industry for several years. You suspect a bladder cancer in this condition. What is the most likely subtype you suspect? So as we all know, painless hematuria is the most common symptom if you have read surgery, the most common symptom of bladder cancer is your painless hematuria. Okay, please remember this. So you suspect a bladder cancer over here, and the person has been working in the dye industry. So which is the cancer which is commonly associated in this condition? So please remember, the most common type of bladder cancer is nothing but your option B, that is your transitional cell carcinoma. So अगर ये भी नहीं पता कि डाई के साथ कौन सा कैंसर एसोसिएटेड है, this you very well know that the most common cancer which is associated, which is the most common type of bladder cancer is your transitional cell carcinoma. Important one. Okay, so transitional cell carcinoma is the most common type of bladder cancer, and in urinary bladder, as we all know, there is urothelium or the transitional cell lining, which is C. Okay, so squamous cell carcinoma in bladder is mostly associated with the infection of schistosomiasis. Okay, schistosomiasis is a fluke. Okay, so schistosomiasis infection is commonly associated with squamous cell carcinoma of bladder. याद रख लेना. Moving further, a patient had very low values of TSH. So there is low TSH along with elevated levels of T3 and T4. What do you suspect? So definitely if there are elevated levels of T3 and T4, definitely we are suspecting what? We are suspecting hyperthyroidism. We are suspecting hyperthyroidism. Hyperthyroidism can be of two types. Either it can be primary hypothyroidism or secondary hyperthyroidism. So primary matlab kya hai? If there is pathology in the thyroid gland itself. If there is pathology in the thyroid gland, then what happened? There would be elevated levels of T3 and T4, and this elevated levels of T3 and T4 would then inhibit the pituitary gland and would decrease the level of TSH, by feedback inhibition. So this is what is our cases. So this is a characteristic case of primary hyperthyroidism. Secondary hyperthyroidism kab hota hai? When there is pathology in the pituitary gland, when there is pituitary adenoma which secretes excess of TSH. So in this case there would be elevated levels of TSH along with elevated levels of T3 and T4. So definitely it is not secondary hyperthyroidism, it is your primary hyperthyroidism which is seen, and the most common cause of primary hyperthyroidism, as we all know, it is your option A, Graves' disease. Please remember, the most common cause of primary hyperthyroidism is nothing but option A, Graves' disease. याद रख लेना. In Graves' disease, which are the antibodies which are formed? Please remember, those are your LATs, that is your long acting thyroid stimulating antibodies, okay, which are formed in cases of Graves' disease. Moving further, your next question. An alcoholic presented to the emergency with complaints of discomfort and pain in the axilla. He rested on an armchair which was compressing the axilla and was diagnosed to be a radial nerve injury. Which type of injury this will be classified into? So please remember, this is a characteristic case. Normally an alcoholic presenting to you on a Sunday or a Monday, okay, after a Saturday night when he was drunk totally and was resting on an armchair and which compressed his axilla region, okay, leading to compression of this radial nerve, causing radial nerve injury, leading to wrist drop in some cases. Okay, this is a characteristic case. So इन्होंने बस क्या पूछा अभी फिर? इन्होंने ये पूछा है कि what is this type of what is this type of nerve injury? So they have asked you about the Seddon's classification of nerve injury. So please remember, they have asked you about the Seddon's classification of nerve injury. Okay, as we all know, important one. This is very important to be remembered from orthopedics. So please remember this. यहाँ पे already उन्होंने क्या बताया? There was compression in the axilla. Okay, there was compression in the axilla, and just compression of the axilla would lead to a compressive nerve injury. Okay, and which is option B, neuropraxia. There are 3 degrees of nerve injury according to the Seddon's classification, as we all know. The first degree is your neuropraxia, jahan bas there is only compression and the nerve injury resolves by itself. Okay, the nerve injury is self-limiting, resolves by itself. There is only compression. Okay, neuropraxia. We need not do anything else. Just we can provide a support with a splint for the time. Then the second degree is your axonotmesis. Second degree is your axonotmesis. यहाँ पे क्या हो जाता है? There is disruption of your myelin sheath. There is disruption of your myelin sheath or your endoneurium. Okay, there is disruption of your myelin sheath or endoneurium, due to which the conduction is affected. Okay, so जो normally conduction होता है ना, that would be affected due to disruption of this myelin sheath. Okay, this is your second grade of nerve injury, and the third grade of nerve injury is your neurotmesis. Neurotmesis में there is complete transaction of the nerve. There is complete transaction of the nerve. ठीक है, पूरी nerve ही गायब है. And axonotmesis में क्या होगा? Tinel's sign would be seen. Please remember, this is very much common question which can be asked. Tinel's sign is seen. Okay, Tinel's sign is suggestive of regeneration. Tinel's sign is suggestive of regeneration. Okay, please remember, important है. Which is only seen in cases of axonotmesis, not in cases of neuropraxia or neurotmesis. Moving further. Now, a patient presented with inability of the middle finger to flex. Okay, so middle finger है ना वो flex नहीं कर पा रहा है after a surgery, which is the structure which has been damaged. Okay, so option A is flexor pollicis longus. As we all know, flexor pollicis longus tendon is attached to the thumb. Pollis na, so it is attached to the thumb. Anyways, this option is totally ruled out then. Next option is flexor digitorum superficialis. Flexor digitorum superficialis tendon is connected to your proximal interphalangeal joint. Okay, so अगर वो डैमेज होती तो बस PIP फ्लेक्स करने में दिक्कत होती. DIP could have been flexed. Next, flexor digitorum profundus. It is attached with your distal interphalangeal joint. Distal interphalangeal joint अगर फ्लेक्स नहीं हो पाता, then it would have been your FDP injury. But here क्या बोल रहे वो? The middle finger totally cannot be flexed. Neither the DIP nor the PIP can be flexed. So this is a characteristic case of median nerve injury. This is a characteristic case of median nerve injury. और क्या है ये case? This is the sign which can be seen. Okay, if the middle finger cannot be flexed, this is the sign which can be seen. And this is what? This is your pointing index sign. This is your pointing index sign, very much characteristic of your median nerve injury. Also, you can see this sign which is your benediction hand or Pope's hand. Okay, or ape thumb deformity is also seen in cases of median nerve injury. Important one to be remembered. Moving further, next one. A child had an injury and presented to the casualty with the below given attitude of the limb. Okay, this is the attitude of the limb. क्या दिख रहा है यहाँ पे? There is, what you can see over here, there is, first of all, there is flexion. ठीक है, there is flexion. Second, there is adduction. Okay, there is adduction. Okay, inward है ना, so adduction है. And third, there is internal rotation. So क्या है? Flexion, adduction, internal rotation. So what is this? The attitude of the limb is fader. Okay, the attitude of the limb is fader. And I have already given a mnemonic. Fader मतलब father मतलब papa. So P stands for papa, P stands for posterior hip dislocation. So please remember, posterior hip dislocation is seen, posterior hip dislocation के साथ we can see this fader attitude of limb, flexion, adduction, internal rotation. Remember, posterior hip dislocation is the most common type of hip dislocation. Okay, the other types of hip dislocation are your anterior and your central fracture hip dislocation. So anterior में the attitude of limb would be Faber, that is your flexion, abduction, external rotation. Important. Okay, so in posterior hip dislocation, it is mostly due to a dashboard injury. It is mostly due to a dashboard injury. When you are driving a car, okay, when you are driving a car and a sudden impact is there, okay, this can lead to this posterior hip dislocation. And in cases of posterior hip dislocation, which is the most common nerve injured, so please remember the most common nerve which is damaged in cases of posterior hip dislocation is your option D. The answer was sciatic nerve. So sciatic nerve is damaged in cases of posterior hip dislocation. Please remember this. Okay, common peroneal nerve is damaged in cases of fibular neck fractures. It is fractured in cases of fibular neck fractures, which are also known as bumper fractures. Okay, bumper fractures. Then, and posterior tibial nerve can lead to the burning feet syndrome. Posterior tibial nerve injury can lead to the burning feet syndrome. Moving further, a person with a month history of hip pain and true limb shortening was diagnosed to be a case of tuberculosis. So this is a case of bone TB. Okay, here hip TB mainly. So which stage it is classified into? So as we all know, hip tuberculosis is classified into 4 stages. That is your early synovitis being the first stage, then early arthritis, late arthritis, and lastly the advanced arthritis. So these are the 4 stages of your hip tuberculosis. And the most common site of hip tuberculosis is your acetabulum. So please remember, the most common site which is affected in cases of hip TB is your acetabulum. Whereas if they ask most common site of bone TB, then your answer would be vertebra. Lumbar vertebra is the most common site of bone TB, followed by your hip, where the most common site is your acetabulum. Okay, so यहाँ पे क्या हो रहा है? There is hip pain and there is true limb shortening. So in cases of early synovitis, there is no radiological finding which can be seen, and there is only a apparent limb lengthening which is seen. लगता है हमें कि limb lengthening हुई है, but there is no such limb lengthening. There is just apparent limb lengthening which is seen. In cases of early arthritis, we can see limb lengthening. Okay, true limb lengthening is seen in cases of early arthritis, whereas true limb shortening is seen in cases of late arthritis, where we can see the radiological manifestation, that is decreased joint space. So please remember, as there is decreased or reduced joint space or loss of joint space can lead to this true limb shortening, which is characterized by the stage late arthritis of hip tuberculosis. Please remember. And in advanced arthritis, there can be various bony deformities which can be associated. There would be total disruption of your acetabulum. Moving further, which among the following is not a symptom of panic attack? As we all know, what are panic attacks? So please remember, panic attacks are sudden severe episodes. Okay, they are sudden severe episodes of anxiety. So please remember, sudden severe episodes of anxiety are known as your panic attacks. So panic attacks में क्या क्या होता है? There is a feeling of impending doom. उसका मतलब क्या है? The person feels like I am going to die, okay, at any point of time. So the person feels like I am going to die at any point of time. This is known as your feeling of impending doom. There is a fear of death, that is known as fear of feeling of impending doom. Next, palpitations. Obviously anxiety है, so there would be tachycardia, there can be palpitations, there can be excessive sweating. Okay, next, there is episodic anxiety. Yes, I have already told you there are severe episodes of anxiety, so it is episodic anxiety. So please remember option C, suicidal thoughts are not seen in cases of panic attack. Please remember, suicidal thoughts are not a component of panic attack. याद रख लेना, suicidal thoughts are not a component of panic attack. If there is more than one episode of panic attack in a month, then it can be characterized as panic disorder. Okay, moving further to your next one. A chronic alcoholic after the last drink, okay, so chronic alcoholic after the last drink 4 days prior now presents with seizures and he had altered sensorium. Okay, he shall be treated with. So सबसे पहले तो seizures में present कर रहा है, and there is also altered sensorium. Altered sensorium का मतलब क्या होता है? There is delirium. Okay, and delirium in cases of a chronic alcoholic after stoppage of the drink, okay, or maybe the last drink is 4 days prior. This is a characteristic case of delirium tremens. So please remember, this is a characteristic case of delirium tremens, okay, which happens to be after 48 to 72 hours after the last drink. 48 to 72 hours after the alcohol stoppage, there is delirium tremens, which is characterized by altered sensorium, seizures, all these features. Okay, so here what would be the treatment of choice? IV methylcobalamin, B IV thiamine, C IV thiamine plus lorazepam, D IV methylcobalamin plus lorazepam. So seizures है तो हमें definitely lorazepam देना is जरूरी. Okay, so first two options are anyways ruled out. Okay, lorazepam is necessary in cases of alcoholic withdrawal seizures. Okay, so please remember, no anti-epileptic drugs are used in cases of alcoholic withdrawal seizures. We tend to use benzodiazepines, which are safer options. Okay, so benzodiazepines can be used, like diazepam can also be used, but as diazepams is actually conjugated in the liver, therefore in cases of alcoholics there can be cases of deranged liver functions. We tend to use better or safer options like lorazepam or oxazepam in cases of alcoholics. Okay, so याद रखना, lorazepam is the drug which is used for alcoholic withdrawal seizures. Along with it, as we all know, you have already discussed with Dr. Bharti that in this case, in chronic alcoholics, there can be a case of Wernicke's encephalopathy and Korsakoff's psychosis. There can be a case of Wernicke's encephalopathy and Korsakoff's psychosis. So please remember, in this case there is vitamin B1 deficiency, that is your thiamine deficiency. So therefore it is always recommended that option C, that is IV thiamine plus lorazepam, are given in condition of delirium tremens. So please remember, so important, after the last drink or after the alcohol stoppage, so 6 to 8 hours afterwards, the patient would present to you with nausea and vomiting, or also with anxiety, and but the most common feature would be your coarse tremors. The most common feature would be your coarse tremors. Okay, please remember. Then 6 to 24 hours afterwards, the patient might present to you with your alcoholic hallucinosis. Alcoholic hallucinosis is characterized by auditory hallucinations. Okay, alcoholic hallucinosis is characterized by auditory hallucinations mainly. Then almost 24 to 48 hours afterwards, the alcoholic might present to you with alcoholic withdrawal seizures, and these alcoholic withdrawal seizures are characterized by generalized tonic-clonic seizures. And if after 48 to 72 hours the person is presenting to you with ongoing seizures and altered sensorium, then this is a case of delirium tremens. Important. Moving further, earliest symptom of alcohol withdrawal is, now I've already told you the earliest or the most common symptom which presents after alcohol withdrawal within 6 to 8 hours is nothing but your coarse tremor. So option A, coarse tremor is your answer. Moving further. Okay, so yeah, thank you so much guys. I hope we have completed all the questions from psychiatry, pharma, and your orthopedics also, along with some pathology questions. Okay, so we had also overlaps from microbiology, so we have also tried to cover some microbiology questions also, and I hope all of you have marked it correct. Let's await the results right now. Okay, and all those who are appearing for the FMGE December 2021 examination, please I would recommend you to see these repeat topics that we are taking right now when you actually come near to your closer to your examinations. Okay, please remember, because many of the repeat questions have been asked in this examination also, and we strongly believe that these repeat questions would be asked also in the December examination. Not the same questions, but at least related questions or from the very common topics. Please be connected with us throughout this session of your December 2021 examination. So we will be actually telling you like how to approach to these questions. We will be talking with you about the clinical case discussions. We will also be telling you about what are the topics, the most important topics to be focused. Okay, so yeah, and after your results we will be coming up with the live session with all three of us together. So just what should be the future plan for your examination of December 2021 exam for all the people who will be attending the December 2021 examination, and all those who have given the results. All the very best guys for your results, and let's hope for the best. Okay, so don't be very anxious. Let's meet very soon. Okay, and yeah, thank you so much for the session. Chalo, goodbye, good night, goodbye.